Grand Rising, everyone. This is Veronica, and I'm coming to you from East Coast, South Florida. This is the 8th of February, 2022. Call this episode 1 of a new series I was guided to do, because many people who say they're awakened and ascending and are tuned into stuff, you know, yeah, you see what's on the screen, right? They need a slap of reality because they're living in la la land and not understanding that we are in hell, okay? And you need to understand how the F we got here, okay? Especially with the insanity. It's actually 4:41 right now as I'm recording. I have been up since 3 o'clock in the morning, and it just hit me to start doing this because I saw this story pop up late last night. And I was like, how the F did we get here? You know, so many people are going to be asking that. And I asked that question to myself when I saw this. Okay. So I don't know how many videos I'm going to make on this, but I know I have this one to do. And also when it comes to the real estate market. Okay. And yeah, this is to share with your normie friends. There are plenty of normies out there who are more awakened than plenty of people who think they are, you know, who are on the ascension path, the spiritual path, but they're still so blinded. And I say that because I love to frequent my crystal stores in many different states that I go and visit. And I have to say, they're the wokiest of the woke tards. Okay? Seriously. And it's so disheartening to see that. They're still instituting all their face diaper policies, hardcore. They still have those stickers on the floor, and they actually will like lock you out. And I'm talking in New York, in Atlanta, in South Florida, in North Carolina, okay, in the Panhandle region in Florida. Almost every single one of them behaves this way, and they're they're the wokiest of the woke. All right. So it's like, my God, I don't even feel like buying this from you, you know, but you know, they're all the same way. But I have to put in my 2 cents as I leave, and I will never put on a face diaper ever. Hold your ground. Um, so, and yes, I've been escorted out of many places, kicking and screaming. But whatever, it's the price you pay. You know, you want freedom, you have to scream freedom. You know, we know where that came from, what movie that came from. So, how the F did we get to the point where the Biden administration is shelling out $13 million to distribute syringes and crack smoking kits for equity? There's that word, equity. That very dangerous, dangerous word, equity. Equity has nothing to do with equality or fairness. They like to throw it in together, but it's a very dangerous word. It's a communist word. Equity is extremely dangerous. And my goodness, we need equity in the crack smoking arena. Now, how the F did we get here? Let's read this. Okay, a grant program funded by the Biden administration will furnish syringes and safe smoking kits, among other items, as a means of advancing equity. The deadline for the $30 million program is Monday, which was yesterday, the 7th of February, 2022. The Department of Health and Human Services distributing funds to nonprofit groups and local governments. Among the items, the grant will pay for syringes and safe smoking kit supplies. The kits will allow users to smoke crack cocaine, crystal meth, and other illicit substances. So hey, we got the black folks covered with the crack. We got the white folks covered with the crystal meth. All right. They got it covered. It's called equity, people. Okay, we got the projects. Not to say all black folks live in projects. Hey, guess what? That's what I am. Actually mixed. And so, but that's the way they think. So we got the black folks there. We got the trailer parks covered with crystal meth, right? This is all comic relief, right? Both the syringes and smoking kits are designed to prevent the transmission of infection. Yes, it's to protect you. The government is here to protect you from preventing infection by giving you crack pipes. Of course. I mean, especially with Biden, the invader in chief, the potato in chief, where would he get an idea like this? Why, of course, to protect his own son even. One of the priorities for recipients is serving under-resourced populations, including racial, ethnic, sexual, and gender minority groups, aligning with the executive order President Joe Biden signed upon taking office. You can't make this stuff up. Why, my goodness. The poor blacks and the gender confused and all the browns people, they're not getting their clean crack pipes. We must remedy this immediately. During his long run in the U.S. Senate, Biden helped create the Anti-Drug Abuse Act of 1986, which provided sentences 100 times greater for people possessing crack when compared to the same amount of powdered cocaine. The policy was widely criticized and having a disappropriate impact on minority communities, and the Biden administration now backs a bill undoing the disparities. That was one of the words I have a hard time. While some critics, how dare they, such as Seattle, why some cities, it's 4 o'clock in the morning, why some cities such as Seattle have distributed smoking kits and syringes to residents in order to facilitate safer drug use. Others have banned them. How dare they? They're depriving the Browns people from their crack. Maryland legislators scrapped a similar plan after getting blowback from black leaders and from law enforcement, the Free Beacon reported. Well, where did this idea come from? Where did this idea come from? The grant program will also provide safe sex kits, screening for infectious disease, and wound management supplies to recipients. Well, you got to manage them herpes sores. Yes. How the F did we get here, people? Why? It was all from a study, of course, from people, from science. And yeah. Well, how did we get here? How did we get here? Well, we could take this back to the crack epidemic, which was in the 90s, 80s to the 90s. I remember this as a kid. I remember it showing up out of the blue with all these crack pipes showing up on the beach, in the streets in Queens, especially Queens, Astoria, Queens. Come to find out, that's where, the 3-letter agencies dropped the crack bomb. That's where it started in New York. And I'm sure if you can't guess by my accent, I wasn't born in New York, but I've been there since a baby. I came over here legally on a first-class flight from Haiti, American Airlines, when I was a baby, and I grew up in New York City. And I've lived in a couple of other states, but South Florida is my home, and I love it here, and I've been here for about 15 years, and yeah, go to Santis. But this crack epidemic. Yes, this crack bomb went off in New York in the 80s. And the height of the epidemic, as they call it, was the 80s and the 90s in New York. Okay, crack epidemic is described as the significant increase in the use of crack cocaine or crack in the United States during the early 80s. Crack cocaine was polarized because of its crack cocaine was popularized because of its affordability, its immediate euphoric effect, and its high profitability. The crack epidemic had particularly devastating effects within the African American communities of the inner cities by causing an increase of addictions, death, and death-related crimes. Now, why would you say they would want to supply people with the stuff to actually use this and make it more profitable for the ones who actually make this crap? Especially since it had such a devastating effect in the blacks and browns communities. Why would they do something like that? And by the way, I'll put all the links in the descriptions for this video, okay? So, why? They saying crack first appeared in Miami. Yeah, it went from there and then it hit all the major cities. Especially, they dropped it in the African American communities. Okay? Well, now, Joe Biden was part of that whole thing of the war on drugs. Now he's seen the error of his ways, and now he's trying to make it equitable. Now, how do we get here? Well, here we go. Well, we're going to work our way back. There's the potato in chief himself. He, her, him, right? Are those his pronouns? Anyway, this was almost a year. 1 year delta, okay? This is an article by NPR. We're paying for this, people, us Americans. Our tax dollars are paying for NPR. So, as overdose deaths surge, White House takes steps to build drug policy team. Yes, his drug policy team is helping. They did this. Give them all the credit. What the drug policy team did. They're going to provide smoking crack kits for equity. Okay? I choke on that. Brandon Biden named more of the team that will tackle the addiction crisis on Wednesday while promising a series of policy actions in the first 100 days. Okay. Crack smoking kits is part of his policy actions. The announcement comes as overdose deaths surged to record levels, topping 81,000 fatalities over the past 12 months, according to CDC. Okay. Blah, 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 blah. I don't give a damn about these demons' names who work for him. The president has tapped the right people. But the problem is both ingrained and immense. So this is from somebody who teaches in Emory, which is located in Atlanta. It's a prestigious university. Keep your kids away from those prestigious universities. Some addiction experts have questioned whether the Biden team has the bandwidth to tackle the addiction crisis while coping with the pandemic and its economic fallout. Well, they came up with a perfect solution. Stop the spread by giving clean crack pipes. Come on now. Y'all not on board yet? The country is facing many simultaneous crises, and President Biden understands that. Yes, he does. Those and the people who have their hands up his butt, moving his mouth around like a puppet. According to Wednesday's announcement, immediate effort to curb overdose deaths will include a new focus on racial equality. What am I saying? Equality? My bad. That's not that word. Racial equity in drug policy and expanding access to medications used to treat opioid use overdose. Again, according to Wednesday's announcement, immediate efforts to curb overdose deaths will include a new focus on racial equity in drug policy. You mean in drug use? Okay? In its statement, the Biden administration noted 2 new members of blah, blah, I don't care. All right? So Biden picking people with personal experience and public health backgrounds to lead them reflect much on what we have been urging. So why isn't his son on this commission? I mean, God, he has a lot of personal use experience, doesn't he? He's probably the one who came up with the whole crack kit. No, he's not. I'll show you exactly where the crack kits are. In fact, you can purchase them online in Europe, all over the east side of the globe. Yes, you can. Right here. In fact, you get free shipping. Oh, yeah. Free shipping included. Free shipping on all UK orders over 30 pounds. Wow. Thank you. You can get your crack pipes here. Box of 100 self-assembly crack pipe kits with a low unit price to facilitate wider distribution by drug services as a route transition intervention, promoting inhalation as a safer alternative to injecting. Crack pipe supply now has an increased urgency as preventing pipe sharing via adequate supply is a COVID-19 prevention measure. Yes, yes. Crack pipe supply now has an increased urgency. It's urgent to supply you with your crack pipes, as preventing pipe sharing via adequate supply is a COVID-19 prevention measure. Are you hearing this? Now, where are they getting this idea? Where are they getting it? I'm going to show you where they're getting it. It's all coming. You see how I just clicked on that link and it popped up to this article right here? The International Journal of Drug Policy. And this is dated, this is volume 83, dated September 2020, right? When the epidemic was really stirring up. It's dated September 2020. But where did they get that from? Blah, 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 blah. Here we go. Right? This is in Canada. This is December 2011. December 30th, 2011. 9 years ago. Correct? 9 years ago. What article are they citing? The exact same article. The exact same article. BMC Public Health. They're all citing the same, and here's the article. Right here. They're all citing the same article, and it originated right here. International Journal of Drug Policy. Okay? What's the date on this article? May 4th, 2011. It was received October 5th, 2010. Reviewed May 4th, 2011. Accepted May 7th, 2011. So it was They originally came up with it in 2010. Uptake. This is their research paper. Benefits of and barriers to safer crack use kit. Distribution programs in Victoria, Canada. A qualitative exploration. Uptake, benefits of and barriers to safer crack use kit distribution programs in Victoria, Canada. So Victoria, Canada, thank you. Thank you so much, Victoria, Canada. Thank you so much, International Journey of Drug Policy, BS crap, for coming up with this amazing study. And they're all citing the same freaking article. We have over here, Irish Times, January 25th, 2021, a year ago. HSE hands out almost 50,000 crack pipes in 5 years as number of users rises. And from what I heard from many Irish people, that drug use has been insane. The health service began distributing crack pipes several years ago as part of the government harm reduction strategy outlined in the National Drug and Alcohol Strategy. The sterile crack pipes are distributed by the HSC, which is the Health and Human Services, the health department, for them, and local drug treatment agencies to prevent crack cocaine users from engaging in risky behavior such as sharing crack pipes or making their own. They don't want you to make their own. They want to profit off of it. Why would they want you to make their own? Okay? And they all, again, cite the same exact article. So they just started this back years ago. But now, why are they doing it? They're using COVID-19. Okay? So what did this international, quote-unquote, journey of drug policy say? An urgent impetus for action, safe inhalation intervention to reduce COVID-19 transmission and fatality risk among people who smoke crack cocaine in the United Kingdom. Wow, this article made it all the way to the UK. Crack cocaine use is rising in the UK, with smoking the primary form of administration. Provision of safe inhalation equipment for crack cocaine is prohibited under UK law. Pipes used for crack cocaine smoking are often homemade and in short supply, exacerbating COVID-19 transmission and respiratory risk. Really? So it's the COVID that's going to give you the respiratory risk, not the smoking of the crack cocaine. All right. I'm not going to read the whole thing because this stuff makes my head hurt. It is crucial that people who smoke illegal drugs are considered a vulnerable population in regard to COVID-19 transmission and fatality risk. With innovative harm reduction measures scaled up in response. So yeah, I'll let you read the rest of this. And again, they cite the same article. COPD, yeah. So yeah. So now you can buy your crack pipes from the government because they want their cut. They want their cut. Isn't it how huge dealers do their thing? They have to have their cut. So you see it in British Columbia, you see it all over Canada, you see it in England, and it all originated from this lovely article back in 2010, and it was published back in May of 2011 from the International Journey of Drug Policy. If that doesn't sound like a BS name, I don't know what does. Okay? So, yeah, that's how we got to Biden administration to fund program to hand out crack pipes. February 7th, 2022. So it finally hit the shores of the United States. The U.S. Department of Health and Human Services, again, topsy-turvy clown world, Department of Health and Human Services Health, all right, is reportedly seeking to give grants, they already did, $30 million, to programs that hand out crack pipes to drug addicts as part of a program to keep drug users safe. Everything is backwards. This is topsy-turvy clown world. The idea is to limit infections among drug users. Give them crack, save them from COVID. Even though we don't see these addicts in the streets, dead all over the place, right? These homeless people. A $30 million Biden administration grant program includes money for nonprofit, be careful, those nonprofit groups to purchase safe smoking kit supplies, according to a report in the Washington Free Beacon. Well, it's not just in Washington Free Beacon, it's all over the place. The pipes would also hopefully convince people to smoke instead of injecting drugs because injections are reportedly riskier. San Francisco and Seattle have tried crack pipe distribution programs. Of course they have. That's why they look the way they do. News of the pipe program came the same day that the Justice Department signaled that it might be willing to allow safe injection sites for people who use heroin and other drugs. The first officially authorized safe injection site opened in New York City in November. And they're called overdose prevention centers. What a crock of crap. And I know we've heard of this before. I know I have. With these a few years ago, with these injection centers. But now they're outright going to start distributing crack pipe kits. So that's how we got here. That's how we got here, people. Please share this widely. I am banned from all social media. I am one of the plaintiffs actually, who's actually on the big tech lawsuit from the real POTUS. I am being represented by his law team. So I'd appreciate the share, because I'm sure many of you are sitting there saying, I can't even. So, yeah. Stay tuned for the next episode about the quote-unquote real estate bubble, because you have a lot more power than you think. The everyday person has a lot more power than they think to stop this nonsense. All right. Much love. Peace.